It's a new year. It's already 2025. I can't believe it. Like, it seems like 2024 just disappeared so fast. And I know you're probably feeling about the same thing, but it's buyout day. We are saving horses. We are saving lives from going to slaughter. I've seen some ridiculous comments online. They're like, they don't actually save them from slaughter, or why would they save the ones that would never make the trip anyway? It's like, yeah, those horses, if we don't save them, they would either go to slaughter or just be neglected and abused until they die. And neither one of those options is a good option. I'm up here in the quarantine. The horse is already here. They're getting checked in at the office, and soon the doors are going to be opened, which is sad because it's kind of cold outside. It was 19 degrees this morning here in Middle Tennessee, but we've got some heaters. I'm going to show you the 2 heaters we have, and we are going to have to turn the big one off because it's pretty noisy. You can probably hear it in the background. So this is heater number 1. It's perfectly quiet, but it doesn't put out a whole lot of heat, but it's definitely going to be a nice spot to warm some hands. Oh, feels so nice. And then this one, Mr. Heater, 170,000 BTUs coming right out there. Oh, too much heat, but it's noisy. So anyway, may not be able to be on the whole time because of filming, but it definitely warmed it up in here nice. Horses are here. They're going to be unloading really soon. The vet team is coming up. I see them out the door right now. Everything's going to be rolling here from here on out. So let's see how many horses we save. I'm hoping it's at least 20. We don't know for sure. Never know until they get off the trailer. So the other thing I'd really like is if we could, hopefully we can rescue some horses that are doing really good. And Dr. Lydia just showed up. She says it feels great in here. I agree. It's much nicer than it was this morning. You can see them all back there scurrying around, getting all their vet stuff ready. So I'm going to jump off here real quick, but the horses are here. They're going to be unloading real soon. So let's save some lives. And thank you. I just want to take a second, just real quick second, just tell everybody who donated, thank you so much for donating to save lives. Couldn't have done it without you. And you are really, actually, truly a horse's hero. They even got Vince. Vince has joined our media team, and he's going to be taking photos today. They got him unloading stuff. Alrighty, so they're backing up.
Normally everybody
and
back, unless directed to jump in.
So the transporter just gave us the good news that all the horses are tied. So that's really awesome. So we're going to be able to take them off one at a time. That means they're all at least halter trained, and that's really cool. So let's see who comes off this trailer.
Hi. Good job.
You can come in.
Easy, easy.
Is this the blind one?
This one is not blind.
Okay. Oh, skinny.
Let's go ahead and get 8 mils of Banamine to this one. We've got stovepipe leg in the left hind, also possibly neurologic. And I'm just gonna leave halter and lead rope on until we've got more off here. Guys, look at all of you being good citizens up here. Hi, easy. Okay, easy. This next one's in respiratory distress, looks like. Okay, hi. Okay, easy, we're almost done. Easy, you wanna come off? Okay, good job. Okay. This one is super off in the right hind, yeah. Is that more Banamine?
That's 8 mils.
Okay,
that
perfect.
One has not gotten any yet.
Okay. I'm going to prioritize this horse. Seems a lot more painful. Can you hold this lead rope for me, Nicole? I know we're going to have to speed up here in a second. What?
I am also not getting down any of the notes that you're saying.
Okay, that's fine. I'll remember.
Get some painkiller.
Okay,
here.
we just need to remember that this horse got Banamine. Okay. Oh my gosh, look at that leg. Hey, buddy. Can someone find out if the shipper wants all these halters and lead ropes back? This one's a little bit more stable. Hi, friends. Hi. Okay, this is our blindy. Hey, bud. Hi. That's a good job. Hi. Okay, easy. Easy. Oh my gosh, look at that hoof. Ugh. Can you see that toe coming up off the ground, this next one? Oh my goodness. Hey, buddy. Good boy.
So this horse is completely blind.
Boy.
And go real slow and gentle with him.
Okay.
For sure.
Easy. Good job. You okay? He's a good boy. I have not seen him. Jason, I'm going to close this gate and put this horse by himself. Full soft tissue failure. Hey, Nicole, can I have another 10 cc's of Banamine? I don't want to slow things down too much, but I'm going to give this horse pain meds. Oh my goodness.
Oh my gosh.
Hi. I'm so sorry. Hi. Sorry, buddy.
And he's got shoes on.
I know you guys want to get off. Okay. Oh, thank you. All right, friend. Okay, just watch out, Vince. That's a pretty dangerous spot to be. Okay. Easy. Easy. Oh my gosh.
Oh, that's so bad.
Okay. Okay. I'm going to open this up and bring this horse right in. This is going to be our next B number. We already have pain meds on board, and I'm going to put this horse. Actually, let's go right here. Oh, buddy, I'm so sorry. I'm so sorry. Okay. I know. I'm not going to make you walk much further. We've got to get you a safe spot. Boy, good boy. Okay, you're almost there. Okay.
That was not nice to see.
Mid-80s and had
Definitely not nice to
10
see.
cc's of Banamine,
Oh,
Hi, friends. You okay?
Keith hitting the camera again.
Ah.
Sometimes Keith is running the camera, especially if you're watching the members' videos, but Keith was hitting the camera that time. So how's it going, Keith? I heard tell you were a little under the weather for a minute.
I was under the weather for a little while, but I'm on my way back up.
Oh, good.
So.
Okay, friends. Hi. Easy. Easy. You're almost done. Okay, easy. Got another
I don't know.
severe soft tissue. You're okay. Take a minute. Take a minute. Okay, easy. Easy. Good job. Okay. All right, this one might hop off. We got a wrap on this horse's leg. You're okay, friend. Come on. Okay, I'm just gonna unclip this one from the outside.
Woo, that was unnecessarily dramatic.
Easy,
That's
you're
okay.
all right.
So some could say Dr. Lydia is going to run herself ragged, but Dr. Lydia runs, but she doesn't get ragged. She just runs. And
Hi,
runs
baby
and runs.
cakes. What are you doing? Are you the coughing one? We got a foal with really bad nasal discharge. Looks like we might have another blind mini. Okay. I'm gonna strategically unclip and then open this compartment. Open it and let these two I unclipped out. Vince, if you want to stay in here, the only safe place is going to be behind this door. Relatively safe, but not completely safe. Okay, good job.
Aw, look at the little
He's a
baby.
good
He's all
job.
sick, but he's a cute little baby.
Easy. Okay. Hi, friends. Easy. Do you have lice? Hi, Pony. Can you see at all? Are you blind in both eyes? Let's see. Oh, I'm sorry.
Is he bilaterally blind?
There might be hope for saving the left eye. It's got a really severe ulcer, so it's hard for me to see if this pony is visual or not, but we're, oh, look at the DSLD in this baby.
Yeah.
Okay, totally blind in the right eye, can maybe see a tiny bit in the left. Hi, big girl. You got some lice?
Draft type?
We can fix that problem. Biggest horse on this load has the tiniest halter. Okay, hang on, let's get this baby
Oh,
unclipped.
that's not good.
Hi, you're right. Is this your mommy? You gonna come off together? Okay, good job. Okay, easy, easy, good girl. Left carpus on this little halter filly.
Alrighty, there's
Hi,
one more
friends.
compartment up there.
Okay, we got, looks like three more vision impaired. Hi, can you see it all? Hi. Okay, Vince, I'm gonna kind of shut you behind this door again. Easy. Easy.
Another
Okay, we gotta
blind
step
one?
down here.
Another
Down.
blind horse.
Good job. Super
Like-
well adjusted blindy. I'm gonna put this one with our other blind friend. Okay, you're doing super great. I'm gonna get you some hay. Just a minute.
Is the little pony in there?
Oh, there's another totally blind horse right over here. Good job. Where did I put him? There he is, he's right here. Hi guys. Hi, look at you, little liver chestnut.
And if you're asking and questioning, yes, this is a big trailer. It's a triple axle. I want to say maybe 36 foot long, or at least 30, and holds a lot of horses. I haven't been counting. I've been just looking at the horses, and I kind of forgot to count, but y'all probably are counting, and we definitely have the number somewhere, so we'll find out when they're all off how many there were.
Chronic diarrhea. Okay. A little off the front. Okay. Come on, buddy. See this left eye right here? It's a pretty severe corneal ulcer. Easy. Okay. Another 100% blind. Easy. 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 Step down. Step down. Step down. Step down. Good job. Good boy. I think we're gonna have to open the thing over there. We got two more completely blind horses. So, good boy. But so far, super well adjusted. Easy. I'm gonna go through here into that little stall. Actually, he might be okay in here with these guys. With some more hay in here. Good boy. Good boy, okay. Okay, I know. Is that your friend? Come here, I'll get you some hay. Good boy. Very good, easy. You guys be nice to him, he can't see, okay? Easy, good boy. Woo, woo.
So this is yet another blind horse. Up to what, 6 now? 5 or 6? Poor guy.
It's a good job.
It'd be so terrifying to be completely blind and not know what's going on.
Okay, here we go. Easy. Look at these horribly neglected
the
feet.
front hooves are in bad
Easy,
shape.
good job, sweet boy. Easy. Easy, good job. Easy. Easy. Step down. Whoop, whoop. Good boy. Good boy. Yeah, do you see anywhere where there's like not a lot of resource competition going on? This guy. Yeah, let's put him in here. Sorry. Let's get him some Banamine. If you don't mind, let's go ahead and give 9 mils. Okay, come here. I'm gonna get you in with some hay. You looking for your friend? He's right there. I only unclipped one. Okay, there we're both in. Yeah, he's real full of himself. Either one of you, I don't care who it is. Okay, good choice. Whoop. All right, can we get this close? Perfect. All right. All right.
Alrighty, so here's the horses that came off the trailer and we rescued today. And then there's one more in here. He's already up there. Dr. Gina's already examining him.
The other stallion.
Yeah, he's the other stallion.
For that trip, that was awful.
So this ended up being a mare?
Good girl. This is a mare.
Oh boy. And you were riding up front with the stallion. That makes no sense.
Can we see your tootsies? Says no, thank you. Okay, good girl. Good girl. Easy, good girl. Good girl. 5?
Galvian's groove is starting now.
Between 5 and 10. Let's look on the other side. Oh, you're one of those. Let's call her 10.
So 10 years old.
I'll put some blood, if we're worried about liver, put some blood in both a green and purple top. Hi, big girl. How are you for pokes?
I missed the horses coming off the trailer. I was in a Zoom meeting with folks in Washington getting preparations and plans in place for introducing the SAFE Act again, trying to get the right avenue so hopefully it actually gets to the floor and can actually be voted on. So yeah, got a lot of things rolling today, but I'm happy that it's done and now I can focus on the horses.
Let's get our microchip out of the way, and then I will try to walk her.
If you could pause for a little second while you're doing it.
Sure.
So I can take a picture of it.
Take a picture of what? Yeah. Oh, you don't have her pictures yet. Got it. Yes. Not a problem. I can definitely do that. It's these two. This one is just awful, awful, awful. That leg is just terrible. Boy. So Nicole is coming with a blood tube
This poor guy.
I know, it's awful. He's very sweet-natured. Hey, bud, good job. Let's get a name for you. Oh, he's only like maybe 7.
Only 7 years old.
I would ask him to walk as little as possible.
This is the horse that has the really broken front
Heart
leg.
rate still in the upper 70s, even with
Man.
pain meds on board.
Pain meds just aren't making him comfortable. It's really sad.
You're such a good boy.
He has shoes on.
I know. He's got a fusion in the left hock and left fetlock. Oh my goodness. He also has a fusion in the right carpus. Active digital pulse in the right front. So see how his foot is angled underneath his body. He's trying to take weight off of this leg. And he's developed support limb failure, basically. This poor guy, what a super sweet boy. Oh, that's very good. You're a super sweet boy.
No brands, no tattoos.
Okay.
Don't know who he is. Don't know his
Yeah.
story. This horse's story will never be told. Like, why?
I can tell you what
Bay,
Hold on.
star, left hind.
I suspect that he was a Amish bred, standard bred. So he was born. He was born with the Amish, and then he was a cart horse, and he injured himself, and they just
Yeah, left front sock.
dumped him in the slaughter pipeline.
There's like a coronet, which is like just
That
a
would be
little
my
bit
guess.
of color, and then there's a sock, and then a stocking is like much higher up the leg. Look at that shoe is like not even functionally on where his hoof is. Okay, buddy. All right, he is very well adjusted blind. So this horse, unfortunately, I'm recommending the last act of kindness for. Sorry, Vince. It's hard to see from standing, but this horse has a severely elevated heart rate. It was in the 80s. He had intravenous pain meds, and it came down to the upper 70s. So he's still very, very painful. He's a super sweet, good boy. When he walks, it's really heartbreaking to watch him walk. His suspensory apparatus, which is comprised of a lot of soft tissue structures, but primarily the superficial and deep digital flexor tendons run down along here and attach down here, and their job is to stop the hoof, and you can see it's just completely flopping down, and this toe is coming up off the ground, and then he also has really severe medial to lateral. So he basically completely tore all of the soft tissue structures in here. And he's very painful, even though he's just standing here looking normal. He also has evidence of injury in his right knee, so he's got 2 painful legs in the front, and then also his right hind. And he's just a super sweet, good boy, just standing here cooperating. Soft tissue structures, the best way to image them would be with our ultrasound. And I think from an educational purpose, it would be great to confirm that, but we don't need that diagnostic in this horse's case. That injury is so severe that there's just nothing stopping that foot, and you can watch when he walks. It's really heartbreaking to watch him walk. You're a good boy. That there's really nothing that we can do for him. We can't go back in and fix those soft tissue structures. And you can also see he's just covered in feces on both of his elbows. He's got some swelling on his elbows, like he's been spending a lot of time laying down trying to get weight off of that affected hoof. Such a good boy.
This horse is completely blind.
He is,
Very well.
and see how he's tearing and squinting that eye, so that those are indicators of a painful blind eye. And this horse has already had pain meds. See how it looks like it hurts him to blink, and he's just blinking and blinking. So he has entropy on. His eyelashes have rolled in and they're rubbing on his cornea. And the cornea is very highly innervated, so that looks like a very painful eye. You're such a good boy. Where's that smell?
He just pooped, so.
It's not a poop smell, it's an infection smell.
Ah.
Yeah, it's his shoulder. Okay, Bubs. Let's take a closer look at you. Oh, hi, Haley. You want this boy? I'm gonna sedate him a little bit so I can really probe and see what's going on with the shoulder. Good boy. We're gonna turn this way. Good boy. Do we have photos of this guy?
I believe so, yeah.
Okay. I am gonna give him some Dorm and try to see what's going on with this left shoulder. He's got an infected abscess. I'm just gonna do a more thorough workup. I'm sorry, what's that, Nicole?
Did you age him?
I have not aged him. Got a little bit of back discomfort. Call him maybe 13 based on that side. I know, it's very rude. It's very, very rude. Okay, we're gonna call him 13.
13 years old, or young. 13's young.
You don't have any gloves?
No.
We gotta get some gloves. Yep. You wanna go for it?
Yep.
He's anticipatory, like when you hold off, he kind of holds his head, but he's not terrible. You see a puncture somewhere else? Oh yeah.
Something right there.
Yep.
Something.
Sure enough, I bet he got stuck somewhere. Ooh, that smells terrible, bud. Do we have extra blood from him?
Yes.
Okay. I think if we don't end up making a decision on him, let's definitely run a CBC. This almost smells aerobic. Sorry. Yeah, I mean, he's bilaterally blind. I think he would need both eyes off anyway.
Get his wound cleaned up here, get it drained.
Oh yeah, for sure.
Might get a little gruesome here in a second, guys, I don't know.
Does that hurt?
Sometimes stuff sprays out. Might hit Vince down here. Vince is down here taking photos. And
Oh, well, I just tried to spray Vince with betadine and he didn't flinch, so. I should be wearing gloves. We forgot to bring them up here, and I'm impatient.
Did you get the Dorm and
Ivy. All right, are we taking rads of this horse? Okay. Okay. I would love foot rads, because holy moly. I also want bilateral of this to see if there's a big tract. Did that hurt, buddy?
So nice to be in this building. Look at.
what's nice about it?
Okay, so it's not windy. It's a little echoey, but we'll work on that. I actually forgot to wear my boots today, and there is no way I could do an intake in my tennis shoes at the other little barn because you'd be in the mud. But everything's like clean and mud free, and the animals are so much calmer. I am so grateful to Gail and everyone who donated to her match to make this possible. It's incredibly amazing.
Okay, I don't see anything super crazy there. He really can't even pick up that right front, but we can try to take some of the left front. Really sorry. Okay. Easy. Thank you. Okay. Easy, easy. Good. Ooh, ooh. Good boy. Do you feel safe there, Nicole? You want to try? I would try to put the plate on the floor. Yeah, our focal distance is going to be a little off with the plate, but. Woo! That is a crazy long toe. So this shoe should be back here. That's how much we've grown out. It's putting a lot of stress on the back of this leg. Let's do the orthogonal view, and I can shoot from the front. Stat bilateral enucleation. The left eye is stable, the right eye is not stable.
My concern is you've already given him bandage, it's still that painful.
Yeah.
I don't know if it's just from long toes though.
This is Dr. about the ultrasound. Do you want to just see if he can help you log in?
His muscles, if you can see it on here, they're just kind of shaking. And that's with pain medicine on board, so he's definitely suffering, poor boy. He's very painful trying to walk.
Yeah, his right hind is.
Poor guy.
Yeah.
So this is the stallion.
Oh, Haley, be careful. Let's get Haley a lead rope. Good boy. Whoop. 7:10. Good boy. Hi. There's a good boy. How old are you? Can we see your tooth? He's got a scar on the left side of his face. I think he's only 4, but no bites, please. Yeah. He's between 3.5 and 4.5, so let's call him 4.
So oddly enough, this horse actually doesn't care about getting clipped.
Yeah, he says, I'm a big tough boy, I'm not scared.
Maybe he's just never been clipped and he's like, I don't know what this is happening here.
I know the clippers really don't like it up there, do they? This little guy is a 4-year-old stud. He came in, unfortunately for the mare, in a compartment with a mare. So when he got here, he was very, very wound up. Tried to bite me, bit the mare a whole bunch of times. He's very much acting like a little stud. He has something going on with both of his eyes. He's got scars present within either on the lens or posterior chamber. It's hard to do a good opto exam when a horse is wide awake and doesn't want to hold still. He's visual in both eyes, but I'm worried that he's got a congenital abnormality going on both sides. He's got some scars on his face, but other than that, I haven't noticed anything medically wrong. He's been a bit difficult to handle, smashed my hand a little bit, pulling blood, but I'm totally fine. I haven't listened to his heart and lungs yet, and he definitely has 2 testicles for sure that are descended. So that is where we are with him. He's shod all the way around, which is interesting. Normally people don't put shoes on non-riding horses. It's hard to believe that someone would dump a 3-year-old trained to ride animal. It also looks like somebody like clipped up his ears and his neck and his bridle path. So Tony said sometimes they tie horses down at auctions and put shoes on them, which feels crazy and also a little bit deceptive. So that's all we know at this point. I'm gonna grab my stethoscope and listen to his heart and lungs.
Getting your vaccinations.
Do you see where the panel is open right there? Yeah, there's a bunch of mares over there. Come on, sir. Let's go, we're going this way. We're going this way. Be respectful, please.
Justin, go stand in that hole if he doesn't go in.
Look, 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 look. See the open spot? Good boy, good boy. Okay. Looks pretty stable. This pony's in pretty rough shape. I don't know if we can safely get the pony out or if we want to just run this whole group in. We could do that. We don't have photos on them. Couple. Hi, Mama. Oh, you big sweet girl. Come on. Is that your baby? Let's go. Okay, Justin, you ready? Good girl. Whoop.
All right, got the Coggins photos done.
Typically, I'm doing the Coggins photos, and Justin is now doing them, and that would be more of a permanent, ongoing thing. So, It's open. They're moving the horse out. Anyways, I'm very happy Justin's able to do Coggins photos.
It's hard to say, ma'am.
Justin, get the roller host.
Easy, easy. Where did Haley go? What do you think about either dental rods or sedating her so we can put the speculum on? Yeah. Of course you do. Hi. You smell very nice. You're a good girl. You're a good girl.
So this horse has really bad skin condition and is very, very patchy hair. Just super sad.
You're a good girl. You got some cataracts. Thank you, Haley. She's been a real good girl.
Well, our favorite part of the day is saving horses, but this might be our second favorite part of the day. The pizza, thanks to our donors. Thank you guys so much for donating directly to our pizza fund. It helps our intake team just keep rolling, and yeah, looks good. Pizza. So what's going on with her?
So far, we know she has some kind of immunosuppression, something going on because of the patchy hair loss. She's trying to eat these treats, but she can't actually get them into her mouth effectively, which may mean that she's got some discomfort in her jaw. Yeah, she basically got none of them in her mouth. Do you guys want to take dental rads, or should I just sedate her a little bit and put the speculum on?
Late 20s?
Yeah, 28.
Okay, this little baby's gonna be next. A little cutie. Yes, big baby. Connie says big baby.
Would this face work? It's a little blurry. I'll re-get one just in case.
So this guy decided to walk himself up on the scale, and he stood there like a good boy, and we can see that he's 750 pounds. So that's pretty funny. He's like, all right, I'm gonna stand on the scale for a little bit.
You're a good boy. Okay.
Trying to get his blood. Come on, big baby.
Oh my goodness.
I think you're a little sleepy for your x-rays.
Okay, okay, okay. You're okay. What you got a big wound right there for, huh? Hi, Bubs. You're okay. Ooh, that's hot. Yeah, sir. Thank you, Dr. Gina. Nicole, why don't you and I swap jobs just because he might be real naughty.
That's okay.
You sure?
Yeah.
Okay. You want to try for a lateral first?
But I'm going to put him in the front,
Haley, is there any chance we could get him squared up a little bit more so we can interpret those angles? See how he's like, yes, beautiful. You're okay, baby babe. Okay. And then so he's already got closure of the physial plates on these. Let's try, can you hold it right behind? Sir. Yeah, I'm not sure there's a lot we can do. All right, let's do the left, same two views. Can you stand on your foot for us, please? Thank you. It is very hard. Whoop. Exposure occurred before software was ready. Look at all of that. He's already got osteophyte formation. Can you stand on it? I know it's super hard. Good boy. That was a lot of movement. We'll see. Ooh. Oh, gosh. Okay. Tani. So, you want me to just explain? All right. Let me put this down for a quick second. So, this super cute little colt has two congenital abnormalities going on in its front legs. This joint right here is the carpus. And you can see on this leg, the carpus is turned out. So this is called carpal valgus. And on this it's turned in, this is called carpal varus. And you can see, even in a draft, there's a lot of heat and swelling. This joint is much worse. So these are congenital conditions, and we identify them at birth. And if we identify them quickly enough, I'm trying to unearth my thing here. Usually we recommend exercise restriction for the first 2 to 4 weeks. Sometimes you can be aggressive with splinting and kind of correcting those, and then often they need surgery. This surgery is much simpler than this surgery, and these are surgeries that often require plates and screws, true orthopedic surgery. This isn't just a simple transection of a soft tissue structure or something like that, so not something that we could tackle. And unfortunately, once those certain stages of bone growth occur, the window has closed to intervene surgically. So in this little guy's case, what I really wanted to know from the x-rays was, does he already have arthritis? Does he have signs of discomfort? Or does he just have these really wonky legs, and can we give him a little bit more time? So this leg actually didn't look too bad. It looked about how I expected it to, but this leg, this carpet is quite warm to the touch. It's already swollen, and what we can see in his x-ray is that he's already got, I would call this severe for a full. So this is collapse of this side of the joint right here, and you can see all of this roughened edges and little bone chips. He's got arthritis here, he's got arthritis here, and then this is the same joint from the side, and you can see all of this roughening right here. And if you compare that to the other leg, so this is the other leg, we have collapse, so you can see the abnormality in these joint spaces. See how this has almost no space in between there and a lot of space here. So you can see that in all three of these joints. But then on the other view, we don't have all of that severe arthritis. We have a little bit actually on this side, but this joint that's the amount of arthritis I would expect to see in like a 25 or 28-year-old, not a full. So this is a lot of pain already. for this poor little guy. So based on these radiographs and watching him move, I'm gonna recommend the last act of kindness, which is really heartbreaking. Like I said, if he was comfortable, we could have tried to buy him some time, probably not a ton of time, because as he grows, this is gonna become more severe and more painful the heavier he gets. He is about a year old and he already weighs 700 and something pounds, so he's gonna be a big boy.
Alrighty, next horse coming in. Cute little horse. Hopefully they're doing okay and go on to plunging into our adoption program. That is always our goal with the horses. Is get them into our adoption program and find them homes. You have got a snotty nose.
Ooh, more than a snotty nose. Hey Nicole, let's get a culture of this one. You should listen to this.
It's that bad, huh?
It's pretty bad.
Oof. So Nicole, if you don't recognize her, is a registered veterinarian technician that has joined our vet team, and she's doing fabulous.
Yeah, it's bad. It's pretty bad.
You poor baby.
You're a good girl. You're a good girl. I'm gonna sedate her anyway, so I'm just gonna sedate her first. You're a good girl.
She's super cute.
Yeah. All right.
You're gonna feel better.
Good girl. So I'm gonna take a sterile culturette and I'm gonna swab this mare's nostrils. She's having difficulty breathing. And we're gonna send this off for culture and sensitivity. And what that means is we're gonna send it to a lab and they're gonna grow whatever types of bacteria are present up, and then they're gonna check and see what antibiotics can be used to treat that infection. What we are finding is that a lot of these horses are coming to us through the slaughter pipeline just incredibly sick, and a lot of them have multiple bacteria, sometimes like 7 different bacteria, but we're also finding that there's a pretty high percentage of antimicrobial resistance. So there's strains that you can use any antibiotics on, there's strains that are resistant to 1 or 2 bacteria, and then there's multi-drug resistant and extreme drug resistant strains. And what we're dealing with in public health, both on the human and animal side, are that more and more we're seeing these superbugs that are resistant to a lot of antibiotics. A big part of our job as clinical veterinarians is to make decisions that advocate for our patients, but also we don't want to overuse antimicrobials if it affects human health too. You can smell the infection.
Some of the things the horses have had, isn't that terrible?
It is, it's very warm.
Some of the things that we've seen through these tests is we've had diphtheria, MRSA, salmonella. Like, these are things that we can get too. And I used to just really love on these horses. Like, sitting there, I'd be like kissing their noses, and we're probably going to be doing a notice out to horse rescuers that there are extremely dangerous diseases that these horses are carrying that they can give to you, which is just so bizarre because it's something as horse people, we've never really worried about. And now we're finding these things that could massively impact your life. I mean, it seems like we've had a number of them with MRSA.
Oh yeah.
Like, MRSA's pretty common.
Methicillin-resistant Staphylococcus aureus.
And if you get MRSA, it's not good.
We're going to do right fetlock. Maybe 22.
Okay, so older, yeah.
I was going to say 20s. Yeah, call her 22. 10 feet away. I feel badly. I wasn't paying super good attention last week, and Vince was like,
Ouch.
oh my goodness.
Yuck.
Shattered pastern.
That is like one of the worst I've
It is, this is where the fracture line went. This horse has been walking around on it long enough that it's trying to arthrodesis this. Let's take the orthogonal view. That's awful. Oh my goodness. I agree, Tanya. I think that's one of the worst ones.
That's just like...
And she's in respiratory distress. Oh my goodness. Ah! Look at all these pieces of bone that are just like hanging out here. So this is a non-union.
That's just terrible.
It's awful.
I want to get a picture of that.
This bone basically like shattered in here, and she's had no choice but just to keep walking around on it.
Somebody should have put it in.
Absolutely horrible. This poor little mare, she's about 22 years old. She is one of the ones that we gave pain medications to immediately when she got here. And her heart rate came down a little bit, but you can see that right front leg she's still pretty uncomfortable on. And this x-ray is just, like, these are the ones that I wake up at 3 in the morning and just, it's so horrific, not just because of how severe this shatter is, but like, this is months and months and months and months that horse has been walking around on an unstable fracture where she's just got bone grinding on bone. Just
like,
so unfair to that animal.
this horse clearly had a really bad broken leg.
Yeah.
And nobody helped her. And she's been in chronic pain since then, and who knows how long ago that was. And then finally, when they decide they don't want her, they throw her into the slaughter pipeline, and that's why the slaughter pipeline is so horrible, is it rewards animal abusers. Instead of doing the right thing for your horse, you can just like, oh man, it broke its leg, well, let's wait till it heals, and then we'll send it to auction. And it's abuse, and it's just rewarding criminals.
Off to grab the next horse. This horse is so incredibly sad. Just fractured leg, old injury, and left to heal on its own.
I know you can't see it all. Ooh, that eyeball. You're okay.
I got you right here.
Easy. Hi, I know. Are you worried about that? I'm going to touch you. Hi. I'm not going to take you, though. I'm going to take your friend right now. Hi, sweet thing. He's a good boy. This horse can't see, so he won't notice that the gate is open. Sweet old thing. Go, it's nice and warm.
Alrighty, I'm doing double duty right now. Gates and filming. And closing. We have really nice garage doors now. And they help keep the heat in. But they have to go up and down all the time.
Oh, okay,
All right.
I'll stop.
Let's catch up with the horse. Probably quite
This thing looks
elderly.
like he has a cookie deficiency.
Cookie deficiency? Definitely.
Did you see how the hind leg
Oh, yeah, sorry.
swivels on the toe? So that's one of those hallmark signs. He's not really doing it, but if they're standing and they're just kind of like, their legs kind of move
Justin's
like this,
taking the official
that's a
Coggins
sign
photos.
that neurologically they're not sure whether.
You got fuzzy ears.
I would just say coronet.
A little fuzzy ear hair. And you got some over on this side. Yeah, buddy.
Oh boy, we're pushing 30.
Hey, you get some teeth.
Yeah, you're missing some tooths. He's a good boy. How I feel about that, because I'm about the same age you guys are, and I do not feel ready to be a grandparent, but
We're not. We're definitely not. You would have missed that, but you heard what Dr. Lydia just said about feeling like she's not old enough to be a grandparent. Well, Tanya and I just found out fairly recently that we're going to be grandparents this summer. And we found out on Sunday that the grandbaby's going to be a girl. So best wishes for Alyssa, who used to work with Horse Plus, and her husband Travis, who also used to work for Horse Plus. And they actually fell in love working at Horse Plus. And now they're having a baby and making Tanya and I old. So anyway, we're having a granddaughter, and end of June is the due date. So super excited about that, but nervous about stepping into the roles of grandparents also.
Everybody should probably listen to this. Systolic, I would grade this as like at least a 5. I haven't listened from the right yet. Ooh, yeah, it's a 6. Poor buddy. Remarkable regurg.
What are you digging for?
I am going to do a cardiac ultrasound in this guy.
Oh, cool. Okay.
One of the amazing capabilities of our new ultrasound is a color Doppler, and so you can actually visibly see regurg. And for my own learning purposes, sometimes the regurg means the blood is flowing back the wrong direction through the heart because the valves are not closing crisply. And so anything over a grade 3, we're doing a cardiac ultrasound on. We're not going to do a super thorough exam today, but I want to put the probe on and see how severe the valvular dysfunction is in this case. I think this is mitral valve regurg, but we're going to confirm. You know, if we could do brain transplants and just give this boy's brain a new body, I would be all about it.
We could give his brain to this, Doug.
We could.
Dental
Doesn't have to be
radiographs
way
are being
up.
taken.
Ready? Haley, I need you to move your hands a little. Yes. Thank you so much.
See what pops up.
I'm pretty sure he has no mandibular incisors. Let's take that again. I'm not sure why we have so much movement. He can just have his head like wherever it wants to be. It doesn't have to be. Nicole, go a teeny bit caudal. Yep. So here's gums. Here's our gum line. And it's running along here. So there's teeth there, but they're just worn to the gums.
You're so skinny, we might get a really great image. All right. Ooh, you're very dilated.
That one looks dilated.
Yeah, very
You want
dilated.
your color Doppler on?
Sure. I'm trying to get a better view.
Oh my goodness. Look,
Yeah.
this valve isn't even closing together. See the valve leaflets just flopping around?
Yeah.
How incredible that is. Okay, let's see if I can remember how to.
I think it's a little, I was going to say
take a
hammer and
quick-
chisel, but it's not.
Oh, I'm the worst.
No, you're fine. It's catching a video of it, so it's okay.
I was gonna say we should video it. So we can
I
watch
put
it.
him in as a patient so we can record it.
Thank you so much.
You're welcome.
So this ultrasound is so good, it's allowing us to see individual heart valves open and close, and they're not even touching each other. Can I make this bigger?
Oh, buddy.
So green equals bad.
It's a lot of turbulence, which you expect to see some because it's under high velocity.
It's just moving in
pressure.
both directions.
But yeah, that's a very,
So instead of crisply moving from one chamber of the heart to the other, the blood's just kind of shunting around.
and this is
Oh,
the
yeah.
other ventricle and atria on that side. Oops, I lost my image. And it's very collapsed
Yeah.
compared to the other side.
So I would say this horse is in like end stage.
Yay. Come to me. Image.
So basically as bad as it can get, heart-wise.
Um,
No, that's not diagnosed.
What happens over time, horses can compensate pretty well for valvular disease, but the more floppy your valves get and the less efficient they are, the more the rest of the heart has to overwork.
The right side.
Hypertrophic cardiomyopathy happens when the heart muscle is overworking so hard that you have enlargement of some of the muscle, and then you have certain areas where you have atrophy in the heart muscle. So this poor old boy, his heart is just really working hard. Thankfully, his heart rate was relatively normal, so I don't think that he's painful. And based on his teeth, I think somebody loved him and took care of him. He's obviously had good dental work, but he's just skin and bones. I mean, he's got a fluffy winter coat. You can feel every single rib.
That's good. Let's see. Go away. Oh, you've made it hard. One of these you can hear it. That's not what it sounds like when you're listening to it through a stethoscope, but that's the murmur that you hear. Probably all we needed from you, big guy. I'm sorry. You're very handsome. We know you're very skinny. I'm sorry. Yeah, so when we were listening to him, we heard a holosystolic murmur. You can hear it on both the left and the right. We graded it a 6 out of 6 because you can hold your the bell of your stethoscope out and still hear it. You can also palpate it from the outside. So when we were doing the ultrasound, there was lots and lots and lots of turbulence, like crazy amounts, which you expect to see some turbulence around the valves because the ventricles have a lot of high pressure when they're trying to push the blood into the different parts of the body. But that much is very concerning. So Dr. Lydia, looking at it, was saying that she thinks he's probably an end-stage heart failure, or getting very close to it. His heart is very damaged. The left side was very hypertrophic, so it was a lot thicker than it should have been, kind of crushing the right side a little bit. So the right side is what supplies the blood to go into the lungs to be oxygenated, and the left side is what supplies the blood to go to the rest of the body once it's been oxygenated. So the right side being that compromised, I'm worried about how much blood is getting to his lungs to be oxygenated, and that the right side is struggling to get the blood, or the left side is struggling to get the blood to the rest of the body. So
I keep hearing about end-stage heart failure. What does that mean in my
it means,
version?
Yeah, the heart is on its last leg, like it's about to wave its little white flag.
So there is no O, P, Q, R, S, T stages. It's just end stage.
Yeah. So he's very advanced. If he's not there, he's going to go there and decompensate pretty quickly. So before he gets there, I think we're recommending the last act of kindness just to keep him from having to go through that.
I don't see any brand. In my opinion, she's a very well-adjusted blind horse. And Bay, yep. You're a good girl. She looks like a standard bred to me, but she doesn't have a brand. Good girl. Okay. You're a good girl.
This is the completely blind horse, one of them,
Yeah,
right?
we have multiple completely blind horses. This is one of them. You're okay, Mama. You're okay. There's other horses here. I know. Good girl. Good girl. Ooh. Let's give her a little bit of Dorm. I'm gonna go with 0.5. You're a good girl. I know. Yeah, there's other horses here. You just can't see them. You're okay. Good girl. You're a good girl. She's a little worried that she has no friends in here. I think honestly, everything that I'm seeing looks pretty superficial and scabby. She's definitely had some babies. She's got a little bit of edema on her vulva. Let's put her down for a preg check. Oh, that eye looks terrible. This is called a melting desmetacele. You can see there's like a circular part right in the middle. where the cornea has been so compromised that it's just kind of lost all of its integrity. But then you can see this little baby blood vessels coming from the top. That's called neovascularization. So this started off as an infected corneal ulcer, but the body's actively trying to heal it. So this has probably been going on for months for it to be this far advanced. But I would recommend just taking both of these eyes out. This one is stable right now. Doesn't seem to be painful. This one's causing her to have some discomfort. So to me, it looks like she's already had a full, based on her vulva and her mammary gland. I wonder if she went blind and they were like, well, let's breed her. So if we have, I would bump this, if we clear her for enucleation, I would bump the enucleation above the castration that we have for Thursday.
So this horse came down from Ohio State, and she's microchipped, so we're able to find out exactly who she is. She's 5 or 6 years old, depending on when she was born in '99, and she is completely blind, has a very painful blind eye, and so the vets are going to take care of that just as soon as absolutely possible. But she got all the deworming and well, she already had a microchip, but deworming, vaccinations, and she's going back in the pen, and she'll hopefully be able to go through our quarantine program and get adopted.
Oh, hang on, Haley, I got it. Whoa, hang on. Nasal discharge out the wazoo.
I guess we're just going to come back in because the gate wasn't quite open yet. Getting the little horses separated here. All right, Haley got the baby. This baby has ridiculous DSLD in the back legs, or something bad.
Goodness. Where is Justin?
Justin!
Oh.
Let's look at those little back legs.
Yeah, that joint is literally touching the ground. Little Philly. This baby is so tragic. Her left fetlock is literally touching the ground.
This poor baby's back leg, it just literally goes to the ground.
This is a really heartbreaking case. This little filly is not even a year old. And you can see that she's got really severe deep suspensory limb desmitis. This is a condition that we unfortunately see a lot here at Horse Plus. And when you can see when she bears weight on this foot, see how that joint is touching the ground? That's never supposed to happen in horses. When we have soft tissue problems, sometimes we can improve things with splints and strategic wrapping, but in cases like this, the best you can get is just kind of to plateau. And if we have a young baby who's already so severe that she's getting pressure sores on the bottom of a joint from touching the ground, even maintaining at this level isn't an acceptable quality of life. This is a chronic, progressive, incurable condition that we know causes pain. I personally had a horse with DSLD. I managed him for about 2 years with the condition, and he required 3 different pain medications. And he was a much older boy. So this is really heartbreaking. This little filly is just adorable. And this is a heritable condition. So one or both of these parents likely had this condition. These horses should never have been bred, period, let alone to each other. And so this is a result of irresponsible backyard breeding, which is just heartbreaking and also like There are a lot of conditions we can't diagnose from a photograph. This is one of them. If people are like, hey, what's wrong with my horse's leg? This is when you can be like, I can actually tell you from a picture. So there's really no excuse for this. I am recommending the last act of kindness for this poor baby. Yeah, she's already overcompensating, right? And you can see in different parts of the body what happens when you have pain is you kind of shift around and you try to bear your weight elsewhere. But this little girl's got it going on in both legs. The left is worse than the right. So really heartbreaking and absolutely awful for our staff to have to deal with this. This poor little girl. She's very, very sweet. You're a super good girl. Yeah, she is also really sick. She's got horrible, her nostrils are so covered with snot that they're just like caked closed.
Okay, just as we were about to take this little filly out, I was kind of feeling around her, and you can feel the old auction glue they use. It's super strong, but you can feel at least about 4 to 5 spots on her. So she's definitely been kind of run through an auction multiple times. But luckily she's here, and she's just gonna find comfort.
Let's run a CBC and chem on her. Tani, would you like a lead rope? Okay. Good girl. Or boy, actually.
I'm guessing about 12 to 1,300 pounds, maybe 1,250.
You're all right.
Oh, we're at 12.48, so I was 2 pounds off. Not bad.
Feel that? Yeah, not great. I don't know if you can see it from the camera, but it literally feels exactly like very thick memory foam. You gotta feel that? Pretty sizable plaque. So could be protein loss, PLE, protein losing enteropathy. Is causing this mare to lose fluid and create edema, but she's got something serious systemic going on, and we're going to try to find out why.
So this horse also, this really cute little horse, has such bad feet. It's just, oh, so terrible. So sad.
Look at you, what a good citizen. It's a good job. Oh, we've been poked before, have we? Okay, I know, okay.
So what's going on with her?
This horse has pretty, I don't even have words to describe how bad this is. We had one other horse that was actually worse than this in this load, but you can see these founder rings and lines of growth up here at the top, and then it looks like somebody was trying to do the right thing with this horse and had some pads on and some corrective shoeing, but you can see these subsequent lines and kind of bulges in these feet. I suspect that this horse was a primary soft tissue issue with the suspensory apparatus and then a secondary laminitis issue with the way these growth rings are. This horse has had pain meds, and I just gave a little bit of sedation because it hurts my heart to watch this horse walk around. So we're gonna take a closer look and just see if there's anything we might possibly be able to do. But this looks from the outside really awful and like something that we might not be able to fix. The other 3 feet don't look so bad, but this right front is just, that toe is way up off the ground with the leg straight. That's a really bad sign. Palpating for the presence of a digital pulse. Oh my goodness, honey, I'm so sorry. So the only way she can put her foot on the ground is to pop this joint out like this and vice versa. So this is further confirmation that we have a major, major soft tissue issue as well as the foot issue.
So this horse is going out to quarantine. Got some diarrhea issues that the vets are worried about and some other things, but hopefully she does okay.
So Nicole, I'm actually going to try to take 2 views on this, one with the foot as it is, and then one with the leg straight. So, So this is what this bone looks like with this horse's foot standing on the ground.
Oh.
Yeah, her foot is on the ground, and this is where her bone is pointing, straight down.
I mean, not
Okay,
encouraging, but
yeah.
encouraging is like there was pads, so somebody was trying to fix this problem.
Yikes. See this slipper? See this little point of bone tip on the bottom? That's a acute founder. So normally we'd put this up on a pad, but this horse is so painful, I'm not gonna ask her to do that. I think this is all just mud. I don't think we can fix this.
And somebody was trying to fix it.
Somebody was trying. I think we could improve this a lot. I think this looks like I'm screaming and this is going straight down. I think with corrective shoeing, this horse could have been fixed, but I think that ship sailed probably a year ago. Also got a lot of bone density loss up here. Yeah. I think even with really aggressive corrective shoeing, she's gonna be
So somebody was trying to fix it and they gave up.
Well, but now her weight is pointing, I mean, like here's the ground, right? Like this foot is on the ground. So this coffin bone is now pointed pretty much straight down to her sole.
Yeah.
Sorry, big girl. I wish we had Elijah on call for buyout days. One side looks like 20, one side looks like 18, so I'd call her 20. Too young to have legs that look like this. Hi, sweet thing.
All right, little blind pony coming in.
I walked right up.
Yeah, she's completely blind. You're okay, honey. Good girl. Good girl.
Dustin's getting the Coggins photos.
Good girl. Oh, okay, I'll get out of the Coggins photos.
Ear gone, eye gone. Hopefully your heart's not gone. Boogers are all sticking out of your eye. Poor little pony.
Scarring on lids. Yes, gelding. Did you get cauliflower ear? This horse had some kind of major trauma on the side of the body. That eye injury is super old. This eye is very painful. I'll get you some more meds, buddy. He looks really hemoconcentrated to me. Look at that. Oh, buddy. Gotta get him some Banamine. Oh boy. You don't have any tooths.
Uh-oh.
Nice, sweet boy. No incisors to speak of. Take some dental rads. See if we can assign
cribber
an
or
age. What's that?
Cribber or age?
I suspect age, based on other things, but I'm gonna look at the rest of the teeth, because if the other arcades are fine, then it probably is wood chewing or cribbing. Oh, you got some sharp points. You don't have a lot in there, but you got some. Ouch. razor blades. Okay. He's got like 65% of teeth. Not a deal breaker for me. I think we could do another enucleation on Thursday. It's the tough call for me is that he's definitely old. He's also got something going on in that right hind leg. So I would want to like bring him in, sedate him, clean his legs up, palpate everything, just take a good look. If blood work is cleared and everything else is good, I think he's adorable. Ponies make great pasture pets because people have to spend way less feeding them. He's gonna have to eat soupy senior food, and he doesn't have a lot of time left, but he might have some good years.
And this guy's going out to quarantine. He's gonna be getting checked later this week, get more thorough evaluation, but he's heading out to quarantine today, so good for him.
One is the next one. You clean that pen. Yeah. And then this pen, it can be cleaned out. All the hay can be cleaned out. Let's get those.
And then through the sweep chute, which this horse doesn't need, up the messy scale, and onto the scale. 990. 990 pounds.
Good girl, good girl. You're almost there. Good, easy, easy. Okay, Haley, just keep walking. Good girl. Easy. Okay. Okay, good girl. Want to keep walking a little bit, Haley? It's that left hind. Okay, you want to stop for a second? Good girl. Hi. Oh, ouch. Okay. Okay. It's got some wither rads. She's got pretty significant reactivity.
That is definitely one easy to read brand on this horse. Haley's gonna figure out who it is and let us know. Cadence's Hope. Cadence Hope in Maryland. Huh. Cool. What year was you born?
2004.
Okay, 20 years old, 21 years old. Nice.
Left side looks like 22. I'll buy it. And then I put the up arrows on the bottoms. Yeah, perfect. And then just the pluses on the top. And she's got inspiratory lung sounds bilaterally. Hi. Here we go. Good job. Take your time. You got it. You're okay. Here we go. Good job. Easy. BCS of 2, maybe.
Hi.
Hi, don't snot on Dr. Gina.
Trying to get a good sample.
Yep. That's okay. You'll still have the... Okay. All right. Ooh, your breath is stinky. Oh, man. We got another oldie with the no incisors. You're okay, Mama. I know. You good girl. So this is not great for animals that need to forage.
Back here, baby. Just do whatever. I don't care. I just think so.
It's not sliver.
Oh, it's pulling extra blood.
So both sides, maxillary and mandibular, are just, the gums are like protruding beyond the level of the teeth. I actually couldn't tell if there were missing teeth because the teeth that are there are worn so low down.
An old man.
He is an old man. I would call him like maybe 34.
34 years old. Done good, buddy.
I mean, we really don't even need the weight.
I don't know that I mean, we need a blood thinning, but Dr. Jane and I
I want y'all to take a look at this horse's back legs.
if she's halter trained, I can just snag her. Hi, sweet girl. Good job. You don't look that old. How old are you? Hi. Can I see your tooths? Good girl. Okay. Oh, you're a baby. She's only 3.
So this is a 3-year-old with completely messed up back legs. I want to talk a minute about this horse and the big lick industry in general. This horse had her tail chopped and her entire back end is just broken down, just barely, like this horse can barely even stand, it's so bad. This horse was undoubtedly being trained to do the big lick. And part of that is cutting their tail tendon for no purpose other than show. And they put chemicals on the front legs, and that transfers a majority of their weight to their back legs. Under normal circumstances, 70% of a horse's weight is carried by their front legs. When they're doing the big lick, 70% of their body weight is being carried by their back legs. And that just destroys their back end. The USDA made a final ruling that starting February 1st, stacks and chains and other paraphernalia and chemicals that they use for soring horses will be illegal. And the amount of fight that everybody from the Tennessee Department of Agriculture, on their official Facebook page, they encourage people to ask the USDA to not enforce the rule to stop big lick. The Tennessee Department of Agriculture should not be encouraging people to ask the federal government to allow abuse. That is absolutely not their job. They need to be encouraging people to treat animals humanely. And this horse is only 3 years old, and it's already broken from the big lick industry. This big lick industry is still going on. It's still destroying horses. We're still rescuing them. And it doesn't matter how much money they spend. They can't spend their way out of the truth that the big lick industry is destroying horses' lives and destroying their bodies. And until that stops, we're going to be fighting the big lick industry. And it doesn't matter how much money they have, how much political influence they have. They can't change reality. They can lie to you on the internet. They can have their trolls, both paid and volunteer, out there trying to tell you, oh, it doesn't happen. That's the past sins. No, the past sins are happening now. This horse is 3, and it's already broken from the big lick industry. So please share far and wide. Keep an eye on horse groups. When people say it doesn't happen, be like, I just saw one that's less than 3 years old, or that's about 3 years old, that was broken down. Because you've seen this horse. I'm going to show you more about it and more of the evaluation process.
Good girl. Come on, sweet girl. Easy. I'm sorry, baby cakes. Easy.
In the Big Lick performance world, they cut the tail and the tendon, so that's why we know, like, she's a Tennessee walking horse, and her tail tendon has been cut, so you can see it's all flipped over. There's like some scarring there, I don't know if you can see that. That's where they cut the tail tendon. I could pull it more and it would flip all the way back. Most likely they put some pads or stacks on her front feet and they started riding her with someone very heavy when she was very young. I mean, she's only 3 years old and she's already dumped and been neglected for a while. And these horses that are in this horrible Big Lick abuse cycle, they literally fall apart, and we see them time and time again in the slaughter pipeline when they've been thrown away. And they like to be like, oh, our horses are perfectly loved and cared for and everything's great. We see the ugly side. We see the side where they are throwing horses away and they're pretending that there's no issues, but we see issues constantly within the Big Lick horse suffering. It's horrific, and I'm thankful this girl, we were able to intercept her, and she's not going to Mexico, and I wish we could fix her, but we just can't. They literally ruined her body. She can't function anymore.
You're a good boy. You're a real good boy. Oh, your baby.
1,025.
He is 3.5.
And he's got a big wrap on his back leg.
He
That's
also
gonna be
has
gnarly.
one testicle.
Oh boy.
Come here, sir. All right, let's see if we can sedate him right here. Oh, you're a real good boy. He is gorgeous. Okay,
And we're taking
let's
the
see
wrap
how you
off
feel
his
about
horse.
this first, huh? I know. Well, oh, it's a diaper. All right. Tricks of the trade.
Looks bad on this side.
Looks totally normal on this side. Doesn't smell very good.
Some minor proud flash, but we would need to take radiographs and see what's going on.
Yeah, let's take some reds. He's been a pretty good boy. I think we can walk him out. Okay. Good boy. But he wasn't bad about me pushing on it or messing with it. Haley, I'm gonna call your mom. You're smashing yourself in there with no backup, no way out. Oh, good boy, hi. Do you feel weird? Oh, you're a very good boy. You're a real handsome boy. If you feel safe, just come straight medial. Good boy, we're right here. Good boy. Okay. Reconnecting. Receptor, 0%.
Says it's on.
Receptor present, 20%. Acquiring. That's weird. Got a lot of periosteal reactivity there, dude. Okay, let's take the, do you feel safe holding it right behind? Okay.
That doesn't look good.
Sure doesn't. So, this looks like a sequestrum to me.
Yeah.
What are we looking at?
What we're looking at appears to be a sequestrum, which is a chronic draining tract. So this is what, actually this is not what bone should look like. There's reactivity on this side of the bone too. But basically, when you have an injury to a bone, so this is what normal smooth bone looks like right here, right? So there was an injury to this bone, and the the bones respond, the periosteal cells respond by making new bone. And so all of this area right here is periosteal reactivity. And the intent of that is to, like, if you have a fracture, they fix it. What really worries me in this case is all of these little bits and pieces right here, because if you have even one piece of devitalized bone that you miss, it just creates a chronic draining tract and you can't get it out. So what this horse needs is bone curette removal of that. All of this area. Like the leg needs to be opened and this all needs to be like debrided.
Yeah.
Which I don't even know if we have the tools to do.
And also, he would have to have like IV, antibiotics, and all that kind of stuff.
What I do think is true is that with a surgeon intervening, this horse has a great chance. Like, he's clinically sound on that leg as it is. That's just not going to heal until this bone gets taken out.
So stupid question of the day that probably won't make it in. How much would it cost at like Tennessee Equine for that kind of a surgery?
I don't know. It's a relatively straightforward surgery. So my pony, I had a pony that I trained and then sold when I was an undergrad. Her name was I Love Lucy, but her show name was Think Pink. She was very cute. She had this happen. She had a much smaller area, and I was an RVT at UGA, and at the time with my employee discount, it was an $800 surgery that included like 3 days of aftercare. That was a couple decades ago.
Because otherwise, this is a young,
yeah, I think
ready to go.
I think this horse is super adoptable, but I would want a surgeon's input on, like, I'm not an orthopedic surgeon.
Right. Is there a resource we could send these x-rays off to, kind of get an idea?
Yeah, absolutely.
And, put it out to our donors. Like, do we want this horse to go through extensive surgery, or, you know?
Yeah, I think he's stable enough that we can find out some more information. He's young and otherwise healthy. He needs to lose his testicles. But I will try to find out. I used to work for an equine surgeon, so maybe I'll phone in a friend and send this to a surgeon.
So they've got about 3 horses left to look at. They're all stable. They're just going to be doing their assessment and intake. But I've got to get down. I've got to get editing so that I can get this out tonight before midnight. And so thank you guys so much for spending time with us. 20 amazing horses rescued, plus we had 1 owner surrender today. So that's 21 horses rescued today. And we absolutely could not do that without your support, without your donations. And keep an eye out. That last horse, Dr. Lydia, really seems like she's excited about the prospect of finding an equine surgeon that'd be able to come in and do the leg thing that he needs to get that bone off his leg. So we'll see. That's above and beyond the standard of care that we can give every horse that comes in, but we'll just have to keep our fingers crossed, hopes and prayers for him. And thank you guys so much for watching, and keep an eye out for the veterinarian talk, you know, the debriefing about how today went, and all the horses. You'll be able to see pictures of every one of them. You'll be able to get their full update, what happened to them, their outcome. And I just want to thank you again from the bottom of my heart. Thank you for making our rescue mission possible, and for supporting Horse Plus Humane Society, spreading truth and positivity about our organization, because social media is so full of negativity and just people that just spout stuff they have no idea about. So thank you for spreading some truth and positivity out there, and for your support. So thank you so much.